take control of their life and causes symptoms such as dizziness, heart palpitations, feeling faint, hyperventilating, sweating, trembling, and nausea. Joseph Wolf came up with a technique in psychotherapy called systematic desensitization, which means decreasing your levels of anxiety or fear gently and gradually. He wasn't the first one to think of this, but he was the one to perfect it. He did this so that people who were afflicted with phobias would have less anxiety and would be able to chase their fears away.
Wolf believed that the reason you have a phobia is that you learned it sometime in your life through the process of classical conditioning, by which some objects became associated in your brain with intense fear. Such learning is possible even in the very young ages. To treat your phobia, you must experience a response that is inhibitory to fear or to anxiety, relaxation, while in the presence of the feared situation.
So Gianna, tell me, what are you afraid of?
I'm afraid of snakes. Everything about snakes creeps me out. They're all slithery, and they got teeth, and a tongue, and just everything about them.
Gianna, might want to look to your right. You're trying something. So it seems to me you suffer from a phobia called ophidiophobia.
If a patient was afraid of snakes to the point that it was interfering with their life, Dr. Wolf's therapy would consist of 3 major steps: relaxation training, construction of an anxiety hierarchy, and desensitization. Relaxation training involved muscle relaxation exercises. Patients would tense and relax various groups of muscles all over their body until a deep state of relaxation is achieved. This may take several sessions with a therapist until the patient can reach a relaxed state whenever wanted. In the next stage, a patient with the help of their therapist would create a list of anxiety-producing situations or scenes involving a phobia. The patient would then organize this list with less stressful situations on the top and the most stressful at the bottom. This list is called an anxiety hierarchy. The final stage, desensitization, is the process of unlearning a fear. First off, Wolf believed that no direct contact with the feared situation was necessary to reduce sensitivity. Rather, the same effect can be done through descriptions and visualizations instead. The therapist would describe the first scene in the patient's anxiety hierarchy. The patient's goal was to stay relaxed during the descriptions. If the patient felt anxiety, they were instructed to raise their index finger. The therapist then stopped the descriptions until relaxation could be reached. The therapist would go down each situation in the anxiety hierarchy until the patient could stay completely relaxed when describing all the scenes.
For the 68 phobias treated, 62 phobias were completely or partially cured after about 12.3 sessions. This was a 91% success rate. Wolf noted that unsuccessful patients displayed special problems that did not allow for desensitization to take place, such as the inability to imagine the hypothetical situations in the hierarchy. Wolf's study suggests that fear is something that is classically conditioned. Someone afraid of a snake irrationally associates them with something that's dangerous and fearful. They might have been bitten by one as a child or a similar traumatic experience. To somebody with a phobia, Wolf concluded that you could use systematic desensitization and slowly expose them to things similar to what they feared. Eventually, gradual exposure might cause them not to be scared of the original phobia anymore.